Have you ever wondered what the P in front of prehab really means? Well, today we're gonna find out. Welcome back to the channel. Dr. Michael Lau, physical therapist. That P in front of rehab, it stands for prevention. It's taking a proactive approach to your health and identifying what are the 5, 10, 15 minutes of movements or exercises that we can supplement into our current training routine. That way we can train for life and decrease the risk of injuries. Whether you're an avid yogi, a CrossFitter, a runner, a hiker, a golfer, there's bound to be things in your normal training program that you are neglecting and we need accessory work for. For example, say you're a runner, we move in the sagittal plane only. We can't forget the frontal plane or the transverse plane. What if you're a CrossFitter? Tons of barbell bilateral work, where we're neglecting a ton of unilateral and single leg stability work. And that's why we have the full body prehab program. This has been over 6 months in the making and by far our most requested program from our members. It's not just your knee, your hip, your ankle, or your foot. It is the full body that we're addressing in this program. And today, I'm gonna walk you through 3 exercises in the program and more importantly, explain to you the why we chose these exercises and the subtle nuances that you have to pick up on to truly take advantage of full body prehab. The first exercise we're gonna do is a mobility exercise. Mobility is so important when it comes to prevention. Each day of our program, we have at least one upper body and one lower body mobility exercise. Now, if I were to meet you in person and you said you had knee or ankle issues, I know that I would want to attack ankle dorsiflexion. If we had hip or back issues, I'd attack the hip or back when it comes to mobility. Say we had shoulder issues, it'd be your shoulder or your thoracic spine. But how do we know what to do if I can't talk to you in person? Well, we're gonna give you the ultimate mobility exercises that hits all of those regions, and that's my version of the world's greatest stretch. So you can follow along with me if you're at home. We're gonna start on the mat. Where we're gonna first start is we're gonna start in a runner's lunge. So that's bringing one of our feet up outside of our hand, and we're gonna drop our hip down as low as we can and lift our chest up. You're gonna feel a couple things in this position. The first thing is that back leg. We're gonna be going into hip extension. Hip extension is so important for opening up our hips, especially with the sedentary lifestyles that we live nowadays. From here, you're gonna go ahead and drop that right knee or the right elbow inside your right knee. As you do that, you can push that knee out and you're gonna feel your groin open up on that side. Each of these positions we can hold for a couple seconds. After that, we're gonna work on getting T-spine rotation. So we're gonna lift that right hand up with our eyes also. We're gonna follow and we're gonna get a nice stretch through our T-spine. In addition, we're getting nice shoulder stability through this shoulder and opening up the shoulders as well. From there, both hands go on the ground and we're gonna go into a downward dog. In this position, we're getting so many good things. I'm getting my hamstrings, I'm getting my calves, I'm getting my nerves in the dura. From here, what I like to do is I like to rock back and forth. So what we can do here when we unload one leg is I can get more of a calf stretch. After that, what we're gonna do is we're gonna transition straight into an upward dog. So this is where we can get some lumbar extension. In that down dog, we worked more on lumbar flexion. In the up dog, we're working on extension. And because the back is in particular an area where a lot of people have issues, I like to rotate through these positions. So we go from a down dog like this to an up dog. And each time we do this, what we're doing with our hands and our shoulders, we are pushing our hands forward, using our shoulder blade muscles, our serratus anterior, and we are driving our hips in the air by using the upper body. So now I'm getting a great serratus anterior and shoulder warm up, but I'm also getting great T-spine extension in this position right here. So I like to rock through this a couple times. After that, we're just gonna switch to the other side and do the same thing. So I'll go a little faster this way. We're gonna drop that back hip into that runner's lunge, open up and back right hip into extension, drop that elbow in, shimmy that knee out to get the groin. From there, reach up to the sky, get that T-spine extension, also nice shoulder abduction on that down arm, and then go into a down dog position, rock back and forth with the legs, get each calf a couple times, and then now we're gonna transition between the down dog position and the up dog position, focusing on letting that back relax, going into full lumbar extension and flexion, and driving with the hands, pushing that mat up and really pushing with your upper body. You may feel a stretch anywhere along the back of your legs. That's the entire posterior chain, the nerve, the hamstrings, everything lengthening. And I love, love, love this position, especially when we're active through the shoulder blades. So again, mobility is going to be exercise number 1. Get ready for exercise number 2. The second exercise I'm going to demo is the side plank plus hip abduction. If we looked at all of our programs, the number 1 exercise that shows up is a side plank, and it's because it is absolutely, positively one of my favorite exercises. So let me walk you through the setup. When we get into the side plank, if I were to ask you right now, what muscle do we hit with the side plank? The majority of you would say core, and you're not wrong. We get so much core activation, especially lateral core activation in a side plank variation. But with the side plank, if we're doing it correctly, it is entirely a full body exercise. So starting up at the top, when you have your neck in this position, gravity's focusing on pushing the head down. We have to keep our neck in a relatively neutral position. It's pretty easy for most of us, but if you've ever had a concussion or a head and neck injury, it's really hard to lift your head up. Starting now at the shoulder girdle, when we put that elbow underneath our shoulder and we have all of our body weight resting on our shoulder, our rotator cuff and our shoulder girdle has to really dynamically stabilize the shoulder in that position. And it's actually really, really hard to do. Working our way down, yes, we get the entire lateral core from the lats all the way to the obliques and the abdominals. Now working our way down, we actually get great hip abductions. So in this bottom leg, when you're on a side plank, you should be trying to push the lateral edge of your foot into the ground as hard as you possibly can. By pushing that foot into the ground, that's what lifts your foot up. And when you do that, you're gonna feel your hip abductors on this outside really light up. In the side plank position as well, if you're pushing through that outside edge of your foot, you're gonna be using all the muscles on the lateral part of our leg, like our peroneals. When we have lateral ankle sprains and we roll our ankle, it's the peroneal muscles that actually work to prevent that from happening. So we are getting a full body exercise just in a normal side plank. Now, where the fun comes in is when we add in a top leg lift or hip abduction. When we add in this top leg, now the bottom leg has to support my entire body weight, and I can't use this top leg to take off some weight. In addition, we are now using the core in what I like to say is a more functional manner. The core's job is to transfer energy, usually in sports or day-to-day life, from the lower extremity to the upper extremity, meaning our core has to be stable while we move our extremities. In this side plank hip abduction, I have to keep everything in my body still. If there's a cup of water on my shoulder or on my hip, it should not be moving, even though that top leg is moving. And that's only possible if I brace and I learn to properly brace my core during the exercise. All right, now it's time for exercise number 3. The third and final exercise that I'm gonna demo is a single leg RDL row. That's essentially a hip hinge on one side, maintaining this position, and then a row with the contralateral or opposite arm. Now, why this exercise? I hate to use the word functional, but it really is a functional position. When we get into a single leg row position, we could be picking up a pencil from the ground, we could be picking up a golf ball. It simulates the demands that we put our body in day-to-day life. Secondly, in that single leg RDL position, we need amazing single leg stance stability at the ankle and at the hip. We have to be able to control this frontal plane motion of where my contralateral hip is or this opposite side hip is in place. In order to build up to that, we have to be able to just balance on one leg and have good calf musculature. So of course, we're gonna progress you to an exercise like this. Moving on from there, to get into this hip hinge position, we need amazing lumbopelvic dissociation. What that essentially means is a hip hinge position. I need to be able to keep my lumbar spine relatively neutral or not moving as much, but moving a ton through my hip. So that's essentially a hip hinge position. When we talk about the prevalence of low back pain, a lot of people with low back pain just don't know how to disassociate the lumbar motions from hip motions. So teaching a hip hinge is a key part of that prehab plan. Finally, adding in the rows where all the fun comes in, because you have to be able to master all those basics to get up to this point. Once you can and you're able to maintain that single leg stance position, everything's firing in my lateral ankle, lateral hip, my core. Now we can add in that row and we can get in good upper body row motion. Pushing is fun, chest press, overhead press, but we actually have to do a lot more rowing motions with the upper body than pushing motions to keep strong and healthy shoulders. Additionally, in this position, we get a nice posterior sling activation, which is essentially my left hip and my right lat. I love this exercise for full body prehab. There are so many other exercises like the 3 that we've gone over. Thank you for following along. If you're looking to be proactive about your health, check out the full body prehab program today. This is literally just 3 of almost 200 exercises in the program that's designed for injury prevention. Start your free trial of the Prehab app today.